Raymond, and I'd like to welcome you to the first of our conversations on Pompey's psychological support. With us today is Dr. Sue Hawkins, who's a practicing psychologist in Sydney who specialises in genetic issues. Also with us today is Renee and Taryn from the Association's committee.
The road to diagnosis was very difficult for many of us. I know I still feel the trauma of it. I feel like I've got post-traumatic stress disorder from the whole process. What are some of the issues that people with a big diagnosis, what are some of the issues that they face?
Well, you actually said one of them, having PTSD after that diagnosis, trying to get a diagnosis. I think with rare diseases, it's really common because GPs just don't see it. They don't think that way. Specialists around their particular organ, they don't look at the whole picture. So when you go to somebody with a sore back, the physio will treat you for a muscle issue. Neurologists will treat you for a nerve problem. And this is a whole body issue. And because of that, you end up feeling crazy. You end up feeling like they think you're a hypochondriac, that they don't believe you, your sense of self. I mean, this is a powerful person. Doctors and the medical people, they're powerful and they know more than you technically. But the whole thing is your condition is quite similar the whole way through, and you know in yourself that something's not right, and you have to follow that. But it is very isolating, and it is takes a lot of self-esteem to keep on going. And when you finally get that diagnosis, it's a double-edged sword, isn't it? It's that I know what this is now, but also, oh no, I know what this is now.
Yeah.
So it's got that double-edged sword to it.
Is it really strange that I actually felt elated getting my diagnosis? I was so thrilled and happy, and my husband was devastated, but for me, I felt very validated. Getting that diagnosis. It was a very strange feeling because I was so happy.
Yeah, that's a pretty normal reaction. I mean, I'm sure this wasn't a few months of looking around. I'm sure it went for a few years. Could have been a very long time. And, basically it says you're not crazy, that everything you've gone through has a reason. The first thing it's a really normal reaction to that. You did mention PTSD. So sometimes that PTSD, if you've got it, if you have flashbacks around how hard it was, the fear you had around not knowing about, and it impacting you in ways you don't even expect, like you get triggered going to a particular medical center, or you get triggered when you turn up at a venue that something happened at, or something like that. PTSD can be worked with psychologically and changed. You don't have to live with it. It's basically a memory that hasn't been processed properly, and then when it comes back up, all the feelings and emotions and sensations come up with it. You can change that to make it into a memory, like you look at something in a photo album. So like it all happened in a photo album as opposed to it all happening as if it's happening now. So that's something psychologists can work with quite easily. And that's an important thing to know. That your husband's reaction is probably a reaction which is normal too for somebody who hasn't had all the questioning about themselves and everything else like that. They're looking at it from the impact of this now, what it actually means for the family. And for you, that could come as a delay thing as well. A bit of the elation can get followed at times with, oh no, what does this mean?
Yeah.
And that wouldn't be unusual either. So yes, that road to diagnosis, the important thing is to keep on pushing for a diagnosis. Follow instincts, follow guts. People do it as adults. They also need to do it for their children. I often find parents of children with a genetic condition have to really push because they know something's wrong and they have to keep pushing. You've got to be your own best advocate and your child's best advocate.
Dr. Hawkins, many Pompe patients speak of isolation and loneliness. How common is this?
I suspect that's very common and on quite a few different levels. There's the physical level of when, obviously, later stage of disease, when people are sort of stuck at home. And there's the emotional level, that the gradual decline and the issues associated with disease impacts on people that way. People, when they're diagnosed with a condition that's rare, often don't want to share it too much with everybody for many reasons, because it's a condition where people do decline, some at varying rates, but there is decline. And they're grappling with it emotionally, this has happened to me, and then they have to tell somebody else. And sometimes they haven't got the emotional space to do that. And sometimes they don't want to be pitied. So for those reasons, they hold it back. But in the same time, by not sharing their feelings and fears and emotions, it is quite isolating to hold all that to yourself as well. On the physical level, when the disease stops you from being able to go out, or you go out, but it's harder to walk, harder to get around, harder to do things. Many people will stay at home and avoid not having to face that, or they'll avoid not doing the next step and perhaps taking a wheelchair because they don't want to acknowledge that this is going to be the next part of my downward journey. It's a way of trying to avoid facing the sort of inevitable long-term outcomes. But that also creates a lot of isolation in that space. And sometimes they get isolated because their friends think, oh no, I don't want to invite them there because they can't come for a walk, or they can't come for the group activity we want to do. And there are times where if you are able to share with your friends and close people that you have this disease and that what it's doing and the impact on your life, there are those times where to reduce isolation, you can actually be a bit more proactive and talk to those friends and say, well, this is what I can do. I can go to the beginning of the walk and I can take the photographs. And then someone can drive me around to the end of the walk and I'll take those photographs and I'll be able to participate. So being a bit more proactive and thinking how you can participate can be one of those things that can reduce some of the isolation and loneliness.
So that was the first video that we prepared with Dr. Sue Hawkins, just for more general Pompe questions. The next video that we're about to play is more for parents and dealing with the loss of children. So we do just want to put out a little warning that it's not probably suitable content if there are any little eyes and ears around. So if there's any young ones, please just make sure that they're not watching this particular part. So we'll go on to video 2.
I would like to welcome you to the second of our conversation on Pompe psychological support. With us again today is Dr. Sue Hawkins, who's a practicing psychologist in Sydney, who specialises in genetic issues. Also with us is Maddie and her sister Jenna from the Association's committee. Jenna lost her son Nate to Pompe in 2016. Dr. Hawkins, genetic conditions like Pompe, the parents and even grandparents often feel a sense of guilt at their child's diagnosis, maybe as if it was their fault. which may even be worse after a passing of a child. What would be your advice?
Thank you, Raymond. That's an important question. And guilt is a very common thing that happens with genetic conditions. I suppose when I'm thinking about what happens with that guilt after a child passes away, I think about the impact of that guilt on everybody, the collective family guilt everybody carries, and how that impacts on relationships and how people behave. Does it actually make somebody stay away? Does it stop parents from visiting more because they feel too guilty? Does it impact on people actually being able to really support another person? Does it impact on you going forward into the next part of your life and enjoying some of it? Because people often feel like I can't enjoy anything, because if I enjoy something, it means I don't hurt as much. So guilt can have very systemic impacts on people after a child dies as well. And then they're not necessarily positive, and they sort of really take away from quality of life. And that tension between guilt and love is very confusing. But guilt doesn't mean love. They're actually not connected. Guilt means your belief system doesn't match your behavior. Guilt does not mean love. And talking to people about that can be actually quite helpful. And if guilt is so paralyzing and impacting on too much, I suggest getting some help around it would be useful. A grief and loss counsellor would be really a good person to see. And having somebody in the family that can just say, hey, you know, I think your guilt is actually a real negative for everybody, including yourself. And it may be useful to get some help around it, because guilt isn't love. Could be one way to move forward.
My question for you, Dr. Hawkins, is that it seems statistically that marriage and relationships breaking down and like divorce is quite common after the loss of a child. You often hear that, you know, parents separate or whatnot because they can't handle it. I know that in our instance, losing Nate, that put a lot of pressure on Jenna and Sean's marriage, but also within our family, and it changed our relationships as a wider family and the dynamic of the family as well. What's your advice for going through changing these changes and also maintaining healthy relationships while you're going through a grieving process?
I would be thinking, when I'm thinking about what the sort of your story, I'm also thinking about the work has to be done before, not during the grieving process. It makes it harder if it's not done before the grieving process, to understand how it impacts, because people grieve in different ways. Some people just don't want to talk about it. They just want to get on, put themselves into their work, not face it. Other people just want to talk about it all the time. And if you've got a couple that are grieving differently, the stress on the relationship becomes really big. And similarly in families, about who should be doing what. There's an expectation of what grief should look like and how you should be and how you should behave. And if you go out and have a great time, you should not do that. So again, that sort of communication about how we grieve is so personal, and the judgment needs to be sort of like, I don't think you can judge somebody for how they grieve. And there's sometimes where when people grieve, they actually start running away from the family to other people to stay away because they can't cope with the pain in the family. And in all those cases, I think, you know, having some, again, going back to some either counselling support, therapy to help those people that are struggling the most is probably a good thing. But you've got time to prepare for this sad death in a way. And if you know that's coming up, as much work as you can do around it, about how to prepare is, I think, really important.
Yeah, I think those are some great points there. I know that I can relate to a lot of those things. I know our family, we're a mixed bunch, and we all definitely deal with things very differently. But yeah, it's just great to know that you sort of need to prepare, but also have to understand that everyone is going to take it a little bit differently and showcase their feelings differently. So thank you.
And the problem is when the people that, if something's different and then the people start saying, well, you shouldn't. And that just creates bigger wedges. When really it's the opposite what you want to do. You want to get closer to each other.
So what advice would you give to parents of terminally ill children, or such as in my case, parents that have had children that have passed, to their siblings? How would you advise that the siblings cope with like the upcoming death of the child? Or, as I said in my case, explaining to my daughter about her brother that's passed?
Again, it's a progression thing, I think, as you said, preparing them for it and allowing them to say what they may need as well to do, or what they might want to do at different stages. Like, you know, what, for example, the sicker the child gets in hospital, if they end up in hospital and palliative care, you know, what role does this sibling want to have? Does it want to come visit? Does it want to just bring presents over, you know, give a card? I think children need to know about the child going to die. I think that's really important, because otherwise it's more scary in a way. What's not concrete can be quite scary. Their imaginations get worse than what's really going on, even though the death is horrible in itself. And then allowing that child to participate in its own grieving process, what it wants to have, what it wants to do at the funeral, what it wants to do afterwards to commemorate, how it wants the house to be set up in some ways in its room. It might want some memory of its sibling. It may want to have a photograph in a certain place. And this is where your grief can get a bit complicated too, because your grief can interfere with your child's grief. And being your child might also pick that up. If the child's worried about getting upset, not to upset you. So telling your child, Mummy's going to be okay. Mummy's sad, Mummy's going to be okay. Mummy's going to be able to manage this. Mummy is never going to leave you. Mummy's always going to be there for you too. And if you're sad, I can hold your sadness too. I think that's a really important thing.